Damas y caballeros, bienvenidos a Cita con su Salud. Estamos aquí en el Penn State Hershey Breast Center para conversar sobre el cáncer de seno, una importantísima enfermedad que afecta a muchas de nuestras mujeres y algunos de nuestros hombres. Pero nos vamos a centrar hoy específicamente en la salud de la mujer y cómo tener el control de nuestra salud. First of all, Dr. Tron, Dr. McCall, it's such a pleasure to be here in your familiar places of work. It's great that you're sharing of your time to talk about this very important issue. And first of all, who's going to talk to us a little bit about the risk factors with breast cancer?
I would like to. I think it's very important to know that breast cancer is very common. In fact, it's the most common cancer among women in the United States. And it's actually the leading cause of cancer-related death amongst Latino women. So breast cancer is very common and it's very important. So I think it's important for us to all think about our risk for breast cancer. But beyond that, there are certain things that make us even at higher risk for breast cancer that we need to think about. So there's some things we can't change, like our age. You know, as we get older, we're at higher risk for breast cancer and we can't change that. Our family history, we can't change that. But then there's some things that we can change and we should think about, and that is having healthy weight. So being overweight or being obese, unfortunately, increases your risk for breast cancer. So having healthy weight is very important. Also, physical activity. Exercising regularly seems to decrease your risk for breast cancer. So that's also an important risk factor that you can modify.
Now, among the other things that you can probably modify, is there anything else other than what we eat? Or in the case, of course, what women eat and how much activity. Is there anything else that they could also?
Well, interestingly, you know, breastfeeding actually is also protective against breast cancer. So women who breastfeed have lower risk of breast cancer. So that's an important thing to remember as well. But we talked a little bit before about family history. And I think that's even though we can't change our family history, it's very important for us to understand our family history. So I would recommend women have conversations with their families to understand if anyone has had breast cancer in their family and who has had breast cancer in their family.
In terms of their families, does it make a difference if it's the mother's side or the father's side?
No, that doesn't seem to make a difference. But the number of people in your family who've had breast cancer does make a difference. And also the closer the relatives are to you. So if your mother or your sister has had breast cancer, that's a more important risk than if it was your grandmother or a distant cousin.
So this talks about how important it is to have at the family table some conversations about topics that are important to the family, but not forget about health.
Absolutely. And that's something I see a lot is when I ask my patients about their family history, people often don't know. It's a awkward conversation to have with your family about what everyone's medical problems are. But I think for your own personal health, it's important to understand what medical problems run in your family so you can better understand what your risks are for all kinds of diseases, but for breast cancer specifically.
Now, there has been a lot of talk, and I would even call controversy, in terms of screening, in terms of that very important part. And we've seen it in the news shows and everywhere about when to start screening for breast cancer. What, in your opinion, what is the best approach?
So the most important thing to keep in mind when hearing all of the news stories about the different recommendations that different organizations in society have for breast cancer screening is that every organization, every society recommends that we do screen, because when detected early, screening is associated with a benefit for women in that you can actually reduce the risk of dying from breast cancer. There's been about a 30% reduction since 1990 in breast cancer death rate. Some of that may be due to better treatments, but some of that may also be due to better screening. So we know that screening is important. So that I think is the take-home message to start with. Everybody should screen. Now, where I think some of the confusion comes in the popular media is when do you start screening, how often do you screen, and how long do you screen for, when do you stop? That's where a little bit of the confusion is. At a minimum, most of the recommending groups say start at 50, go until 75, screen with a mammogram every 2 years. But some organizations recommend starting a little bit earlier, starting perhaps around age 40. And many organizations will say between ages 40 and 50, you want to have that discussion with your doctor about what are my individual risks. Women with a very strong family history of breast cancer, or women who may know that they have a genetic predisposition to breast cancer, may benefit more to initiate screening earlier, closer to age 40, or, and having that discussion with your doctor, I think, will really help each woman to make a decision about what's the best choice for her in terms of starting screening, and also how frequently to screen, whether you do it every year, every other year. Because some of the earlier breast cancers can be more aggressive.
There's some key words that you have said there. Your doctor, conversation with your doctor. And we like to always remind people here in Cita con su Salud is how important it is to have a relationship with your doctor.
Jose, I think it's incredibly important, and thank you for bringing up that point. When you have a relationship with a doctor, not only can they tailor the doctors can help you tailor your decisions about what's best for you with respect to breast cancer screening, but having that ongoing relationship will also help other screenings, making sure that women are exposed to the right screening at the right time, whether it's breast cancer screening, colon cancer screening, and also can help women access additional specialty care if needed, if screening happens to turn something up.
When we talk about screening, what is it? What methods are we talking in terms of screening? And which one, is there one better than the other, or a combination of? So
mammogram is essentially the standard of care for screening. Sometimes another thing that might confuse women is that they're offered additional techniques for detection of breast cancer, or for workup of abnormal breast findings. And other things that are discussed are things like MRI or ultrasound. MRI can sometimes be used in conjunction with mammography, particularly in the case of younger women who might have dense breasts. Sometimes some people recommend it if there's a history of a genetic predisposition to breast cancer. Ultrasound is often used when, in younger women, particularly if a woman or her clinician is able to palpate an abnormal finding on a breast exam. Oftentimes, an ultrasound is useful in conjunction.
Palpate, you mean
touch it,
feel
it, yeah,
feel it.
yeah.
Okay, yes.
And an ultrasound can be useful to sort of determine, to be one of the aspects that can determine what is that? Is that a cyst or something that is a benign finding, a non-cancerous finding?
So there's different kinds of screenings. First of all, your doctor, again, conversation with your doctor, knowing your history, but mammogram is the standard.
I would say mammogram is the standard for screening, but there's what we call adjunctives, or additional methods that could be used in addition to the mammogram that may help either as part of screening or part of a diagnostic workup if something is found.
So if we had to say, screening either starts at 40 or 50, depending on your conversations and your relationship with the doctor, and every 2 years.
Every 2 years,
other year.
At a minimum. I will say
at a minimum.
Some organizations recommend more frequently than that, about every year.
Okay, so some organizations will.
Some organizations do recommend more frequent, and that again is a conversation for you to have with your doctor.
Is this a death sentence? Is this what anyone listening today? What can they? If they have a history, should they be scared? What is the prognosis?
I think it's very important for women to know that breast cancer detected early is very treatable. And so that's why it's so important to recommend screening, because when we're screening with mammography, we're detecting breast cancer at early stages. And we know that those are very treatable cancers. Unfortunately, there are women who get diagnosed with late stage cancers. And unfortunately, some women do unfortunately die of breast cancer. But many women who are diagnosed with early stage cancer do very well.
Bueno, estamos hablando con la doctora Chuang y con la doctora Macal acerca de el cáncer de seno. La doctora Chuang nos ha mencionado que en cuanto al riesgo, hay factores que ustedes, las mujeres, pueden controlar y hay factores que no se pueden controlar. Los que no podemos controlar es la edad, la historia familiar. Esas son cosas con las cuales se va a vivir el resto de la vida. Lo importante son los aspectos que podemos controlar. Cuánto comemos, cuánto ejercicio hacemos. En pocas palabras, nuestro peso. Mientras más pesado usted sea, más riesgo hay al cáncer de seno. Mientras menos ejercicio se haga, mientras menos actividad física, hay más riesgo a padecer de la enfermedad de cáncer de seno. Y entonces, obviamente, estos son factores que nosotros podemos controlar. La cantidad de alcohol que se toma es un riesgo que nosotros podemos controlar. En cuanto a cómo diagnosticarlo, cómo saber si se tiene o no, la doctora McCall nos estuvo hablando sobre la forma en que los médicos hacen lo que se llama en inglés el screening, cómo hacen los tests para saber de cómo lo deben hacer. Y ha habido mucha controversia, hemos oído hablar de que hay organizaciones que recomiendan que se comience desde los 40 años, otras de los 50 años, otras terminar a los 75 años. Indiferentemente, de acuerdo con la doctora Macao, no importa a qué edad se está diciendo empezar o terminar, lo importante que debemos escuchar es que se nos está diciendo que definitivamente se debe hacer. Cuán frecuente o cuándo comenzar va a depender de la relación con su médico. Y ambas estuvieron muy de acuerdo en que esa relación es sumamente importante. Hablar con nuestro médico y que nuestro médico sepa dónde está nuestra historia, dónde estamos nosotros particularmente, para cuándo empezar y cuándo terminar. There was a lot of emphasis on self-screening before that I don't hear as much today. Where does the medical world stand today in terms of self-screening?
Well, when you look at the guidelines, there's no strong recommendation in favor of breast self-exam. And the reason for this is when it's been studied, it hasn't been shown that doing a breast self-exam is associated with better outcomes for women. So what I tell my patients, and this is my own personal practice, is if they want to get to know their bodies and do breast self-exam, I don't discourage it, but I don't see it as a substitute for mammography, which is shown to improve, basically to detect early cancers and potentially improve lives and reduce mortality and death from breast cancer. So if women want to feel their breasts, I think that's a reasonable conversation to have with your doctor to understand about how to do it correctly, to get to know what normal breast tissue is, because a lot of women will feel their breasts, and particularly younger women, premenopausal women, will encounter sort of a lumpy, bumpy feel, and they think, is this normal? So knowing your own body is fine, but don't think that it should substitute for the mammogram, which can potentially detect things much smaller than even a clinician could feel.
Would it be safe to say, and correct me if I'm wrong, by the time you can touch it, it is much more advanced than you would like it to be for a better prognosis?
It's interesting because you'd be surprised some women can detect very small lesions in their breasts, especially if they're close to the surface of the skin. Mm-hmm. So it's not, women can sometimes detect very early cancers as well. But again, as you and Dr. McCall both pointed out, I think it's very important to emphasize that doing self-breast exams is not at all a substitute for getting the mammography screening, because that we know is the gold standard for screening today.
Now, is there a particular heightened risk with having had babies or not having them, sexual behavior? Is there anything that could be associated with a heightened risk or lower risk of breast cancer in terms of regular behavior? How about alcohol intake? Anything like that?
Yes, actually, alcohol intake probably does increase your risk for breast cancer as well. So that is another modifiable risk factor, is to decrease your alcohol intake. And you're right, actually, your pregnancy history as well. So Interestingly, the more that women have been pregnant, it actually protects them against.
Protects.
Yes.
It's incredible how nature
Isn't that
has a
right?
way to
Yes.
protect itself.
Yes. So having been pregnant and also having breastfed both protect you against a risk of breast
So,
cancer.
but it's not the other way around. That
That's
a lot
right.
of times there might be some myths and that if you have used it too much, then you probably will get breast cancer. If you've had it, so that's not the case.
That's not the case. Actually, if, it reduces your risk of breast cancer.
Are there any blood tests? Are there any other type of tests that physicians have at their disposal to look at the risk of a woman having this illness?
That's a great question. Many women have heard of the breast cancer gene, which is also called the BRCA gene or the BRCA gene, which increases the risk of having breast cancer. Now, not everyone needs to be tested for the breast cancer gene. However, there are some women who in their families may have a strong family history of breast cancer, and they should talk with their physicians about whether or not they should be tested for the breast cancer gene. So if you have multiple members in your family who have had breast cancer or ovarian cancer, and especially if you're of Ashkenazi Jewish descent, that also increases your risk. So if you have a strong family history, I strongly recommend you discuss those risks with your healthcare provider, because it may be recommended that you get tested for the breast cancer gene.
Does everyone that have the gene going to have breast cancer? It's a difficult thing to know.
Yeah, it is a very difficult thing to know, and I think it's a good idea to see a genetic counselor to help you decide if you want to get tested, because it is a lot to know, and not everyone wants to know, and it should be a choice that you make if you want to know or not. Women who have the breast cancer gene probably have about an 80% chance of developing breast cancer, and also about a 50% chance of developing ovarian cancer. So the risk is quite high. And some of the things that can be done if you do find out that you have the breast cancer gene, Dr. McCall talked about using MRI as an additional form of screening. So women who have the breast cancer gene will often be recommended to get an MRI screen in addition to the mammography. And in addition to that, some women who have the breast cancer gene will elect to have prophylactic mastectomy in order to really reduce their risk of having breast cancer, and that's certainly a choice as well.
Now, is a mastectomy, does that reduce the risk to 0%? Or
We're not entirely sure. We probably reduce the risk to nearly 0%, but it's probably not impossible.
so again, this still does not get you off the hook to have your conversations with your doctor.
Absolutely, correct.
It does not. And at the end, it sounds to me that the message, at least the way that I am getting it, is that this is about empowerment. This is about knowing yourself. This is about being in control of your health. I would like to thank you both for this conversation. I know that you have a tour ready for us to go check out the mammogram machine. So we're going to head that way and learn a little more.
Great.
Thank you very
Thank you,
much.
Jose.
Thank you. Such a pleasure. Continuando con nuestra conversación, hablando sobre el autoexamen. En tiempos pasados, todas estas campañas sobre el cáncer de seno se centraban bastante en el autoexamen. Las doctoras ahora nos hablan que esto no quiere decir que los médicos quieren que ustedes dejen de conocer sus cuerpos, pero lo que sucede es no sustituir el autoexamen por el examen que su médico le puede hacer. Recuerde que, de acuerdo con las doctoras, la mamografía es el estándar para el examen para el cáncer de seno. Y es muy importante el conocer su cuerpo, pero no creer que porque usted lo conoce, eso sustituye el examen anual. Nuevamente, la conversación con su médico, el contacto con su médico, es lo que va a hacer la diferencia en el pronóstico. Otra cosa que ellos nos han dicho es que esto no es un diagnóstico de muerte. Muchas veces tenemos miedo a la palabra cáncer cuando nuestro médico nos está diagnosticando algo. La supervivencia con el cáncer de seno diagnosticado a tiempo, de acuerdo con las doctoras, es sumamente alta. Recuerde que es muy importante hablar con su familia acerca de la historia familiar con esta enfermedad. Mientras más cerca su familiar que haya padecido de cáncer, mayor posibilidad tiene usted de padecer esta enfermedad. Las conversaciones en la familia, en la mesa sobre qué enfermedades se tiene, la historia médica familiar, son muy importantes, tan importantes como la conversación con su médico. Nos hablaron también las doctoras de que hay un nuevo examen que es el examen genético para el examen, para detectar los riesgos de cáncer de seno. Y este examen genético para detectar si usted tiene o no el gen es un nuevo examen que le puede decir si usted tiene, cuál es el nivel de riesgo que usted tiene. Obviamente, la doctora nos ha dicho, es bastante información para saber, pero existe consejería genética que usted puede obtener para asegurarse de que usted esté preparada para obtener este tipo de información y cómo manejar este tipo de información. Pero definitivamente es la forma de llegar a la prevención más cercana a cero de padecer el cáncer de seno. So here we are with Shauna Gillette at the Penn State Hershey Breast Center. And we're in one of the exam rooms. And we have been talking about screening, Shauna. And talk to us about a little bit about this machine and the procedure that Maria has volunteered for.
Well, Maria has volunteered for a mammogram. This is a state-of-the-art digital mammogram. It's a very low dose image, so patients don't need to fear the amount of radiation they're getting. It's very, very low dose. A lot of patients fear having the mammogram due to the...
Why do you think so?
A lot of people are afraid to come in, especially for the first time, because they fear that it's going to be very uncomfortable. Where in reality, once they get here, they have the exam. It's very quick. It's only a couple minutes. It's really not a painful experience. It's more of a... Some people think it's a little uncomfortable, but it's more of a pressure feeling.
Mm-hmm. So this is not something where there's no invasive, there's no needles,
No.
It's just like having an x-ray. It's just at your breast.
Yes, it's having an x-ray. And what we do is we take 2 pictures of each breast and we compress the breast. And we have to get back to the chest wall so we see all of the breast tissue. And then we compress the breast just to an amount where the breast feels what we call taut, so it feels firm. Anything beyond that causes pain. Now, some women who come in right before their period, we try to avoid having the mammogram done at period time because that's usually when breasts are very tender. So we recommend having the mammogram about a week or 2 after the period starts. That's usually the least tender time.
So that will be the least amount of discomfort.
Yes.
Now, typically after the exam, how long before the patient knows the results?
At our facility, they can know the results immediately.
Oh, so it can be, Maria could leave today knowing
Yep.
her results.
Now, there is one little stipulation with that. If you had images done at another facility and you're coming here for the first time, the physicians will want to compare your images to a prior
course.
year, because that's how we find very subtle changes and that's how we find breast cancers early.
So there will be a comparison that
Yes.
has to be done. Well, we're going to step out and we're going to let you have the private moment with Maria and have the exam done.
Okay?
Thank you so much.
Thank you.
Thank you. Now, Shauna, Maria is done, and that is probably what I would call a standard test. What if Maria would have had implants? Does it make a difference? Is it a different machine for that?
It's the same exact machine. If she would have had implants, and it's very normal, we do implants every day, but what it does is we add an additional 4 pictures because implants can get in the way of the breast tissue. So what we do is we do 4 additional pictures, moves the implant out of the way so we can visualize the breast tissue.
So
It's not-
implants are not a counterindication for
Absolutely not.
women with implants should
Yes.
consider also
Yes.
the same way as any other woman
Yep.
having this test done.
Yes.
Thank you so much. Really
Thank you.
appreciate it. Thank you. Bueno, damas y caballeros, estamos hablando con Shauna Gillette, quien es la tecnólogo jefe de la mamografía aquí en el Penn State Hershey Medical Center, el centro de salud del seno de este centro hospitalario. Y estamos hablando de lo simple, de lo no invasivo de este test, con estas máquinas que se ven muy estándar en todas las oficinas de los médicos. Es un examen no invasivo que tiene un poco de incomodidad, pero donde definitivamente se cuida de que la incomodidad sea lo mínimo posible. En 1, 2, 3 minutos usted puede terminar con este examen, y en un centro como este usted puede irse con el resultado el mismo día de cuál es esta mamografía. Así que es un examen que es sencillo, es rápido, definitivamente no invasivo y que puede salvarle su vida. Bueno, damas y caballeros, muchísimas gracias. Hemos tocado este importantísimo tema. Le invitamos nuevamente aquí en Cita con su Salud a mantenerse en control de su salud. Eso es lo más importante. Tener el poder en nuestras manos, la relación con nuestros médicos. Muchísimas gracias. Hasta la próxima.